The nation's report card on learning is out. It shows just how much of an impact the pandemic had on students.
Students in 4th and 8th grade saw dramatic drops in math and significant dips in reading scores too.
Overall, North Carolina ranks 20th in the country. WFMY News 2's Hunter Funk took a closer look at where Guilford County Schools stand with learning loss.
Yeah, it's a similar story for GCS. The drop shows students didn't retain information as well as they did before the pandemic. Now check out these numbers. For 4th graders, math dropped 7 points from 2019 to 2022. Reading, it dropped 7 points. Taking a look at the 8th graders now, math dropped 10 points from 2019 to 2022, while reading went down 6 points. Now this learning loss isn't a shock for GCS. In September, the North Carolina Department of Public Instruction, or DPI, released student test performance results. After those numbers came out, Superintendent Dr. Whitney Oakley spoke about how the district will need to continue tutoring programs and learning hubs to prevent learning loss.
It's not just here. Our whole country is facing unprecedented learning loss. It's going to take quite some time to recover.
The hardest hit was math. Most of the country saw a decline with 8th and 4th graders. Now, no area saw an increase in math scores. Now, on a positive note, GCS students scored higher than the majority of other large city peers. And Black students outscored national, state, and large city averages in 4th grade reading. Now, DPI says it's this extra data that helps leaders understand where to ramp up the services.
We take this data, these data, and use them in much the same way that we've been using all of our student performance data, providing districts with the data they need to identify the students who have been most disproportionately impacted, and then providing services to those students to help them get back on track.
And DPI says it has nearly $2.5 billion to put toward services for districts. And the GCS board plans to be on November 15th to discuss these results.